Hello, everybody. Today I want to talk about invisible disabilities and how they affect your life. For those of you that don't know, an invisible disability is basically a condition, or it could be a disease, a condition, a disability, a birth defect, whatever you want to call it. Anything that you have that's not really apparent on the outside looking in. So, like, say I have my cleft lip. Well, you can see the scars. You can see how before the fixes something's wrong. And then same thing with my spina bifida a little bit, where you can more or less kind of the way I walk, you can see how there's something not right there. And then with my hydrocephalus, you can kind of see, but not really. All you can see is maybe a scar, and that's probably the only indication you do have. But for some people, they don't always have that. And even with me, there's some things that I have that are not apparent, and it's usually things that affect your organs. So some of you have something maybe that's affecting your liver, your kidneys, your bladder, your intestines, whatever it may be, your heart. And on the outside you look fine, but on the inside you're doing terrible. You can be hurting. You can be need a lot of medication just to maintain yourself. You need a lot of medical help, but a lot of it's not really apparent, and a lot of people don't see it. And so I dealt with this with my spina bifida a little bit, where I need help with walking sometimes, or I have muscle weakness and I need to sit down, and I need to really take care of myself because the muscle weakness really takes effect in my life, and also the spinal damage as well. And also things with my organs, my intestines, they don't function like normal people. And the problem with this is that a lot of times when it comes to receiving medical treatment, or you need some kind of something with your medical stuff as far as insurances, or you're trying to get something, you may not be taking it serious because it's not as visible as, say, somebody maybe with cancer where they're losing their hair. Maybe somebody with some kind of kidney disease or liver disease where you can really see the effects in their body, or somebody with HIV, or who knows what it may be, where you can really see the progression coming along. And the problem with that is that you really need these assistants, or you really need this help, but you're not getting it. And you're actually on your deathbed, or you're close to being, you can die pretty soon, but it's not as apparent. Like, I remember trying to get some assistance because of my spina bifida, and they didn't really want to give it to me because I wasn't in a wheelchair. She kept on looking at me, she kept on saying, "Oh, you're not in a wheelchair, so you don't need it." And I was trying to explain to her, like, I have spinal damage, I might not need the medical assistance right now, but tomorrow's a different story. And that's the problem with invisible disabilities. Like, you could be fine one day, the next day you're not fine at all. You could be on your deathbed. Like with my hydrocephalus, I'm good right now, but tomorrow I might wake up with a severe headache and I can't do anything that day. I'm just totally knocked out, in pain, or whatever the case may be. And the same thing with my spina bifida, I'm fine right now. I can walk right now, but tomorrow I might be so weak that I can't. And there's sometimes where I'm doing my medical stuff, I need that rest period in between, a couple of hours at least sometimes, just to recoup the damage that has been done to my body, just so I can function normally later on for the rest of the day or the rest of the week. It just depends on your medical situation. For some people it's different. For some people, I know it's their intestines, because I have the same problem with me, where your intestines are fine one minute, and the next minute you eat the wrong food and that's it. Now you're out for the week. And so it's very frustrating because you're not taking it serious as people that have something that's obvious, like maybe somebody that's in a wheelchair, maybe that somebody that's in crutches, or whatever the case may be. They're taking more serious with their disability, and you're not, and you kind of just want that. You don't want to, it's not really a comparison thing. You're not trying to compete with anybody, anything or like that. But you're just trying to get the medical treatment that you need, and that's it. Or you're trying to get something that's to do with your medical stuff, and that you're not getting it, and so it's kind of frustrating. And then also you get mocked, and people make fun of you, thinking that you don't have a real disability. They think you're lying, they think you're faking it, and that's not the case. And it's very frustrating to deal with. You gotta do it with the insurance. Sometimes you gotta deal with some of the times with the doctors, and then you gotta deal with the people. And so that's the problems with having an invisible disability, is that nobody takes you serious. And it's like the source of your pain, you have to deal with this condition, whether it be mental or physical, and you're not taken serious at all compared to other people. and you can't help but notice the differences, how they're being treated, and you're being treated, and you're not really trying to get sympathy or anything like that. You're just trying to move on with your life and trying to get the treatment that you need so that you can function as normal as possible, and they will continue on with your life, and that's it. And so I've dealt with this for my whole life, and it's really frustrating. But so what I learned to do obviously is to educate people, like I've been telling you guys. You know, you have to educate people on it. And once again, if they don't take it seriously, then well, then you gotta move on. And in some cases, you have to, as far as like the insurances and the doctors, sometimes you gotta take up a notch. You gotta really, man, you gotta really push it. You know, if you gotta do something as far as like calling the higher ups, then let that be the case. If you have to do something with lawyers, I mean, sometimes you have to do certain things that you don't want to push, but you have to because you might die if you don't. And so that's the video for I have today, and take care, and let me know if you have an invisible disability and how the frustrations you gotta deal with. Bye.